Good morning, my name is Paola Ochoa and I'm going to talk about randomized trials of Posaconazole and Benznidazole for chronic Chagas disease. Definition: Chagas disease, a chronic parasitic infection caused by the protozoan Trypanosoma cruzi, is considered to be one of the neglected tropical diseases. Although Chagas disease was identified more than 100 years ago, current therapeutic options for these conditions are limited mainly to benznidazole and nifurtimox. The phase of the disease is one of the factors that determine the success of treatment. Cure rates of 65 to 80% have been documented when treatment is administered in the acute phase of the disease, whereas the treatment response is as high as 60% among children at an early chronic stage of the disease. Cure rate among adults when the disease is in the chronic phase range from 15 to 35%.
Chagas disease is caused by a highly mobile, microscopic parasite called Trypanosoma cruzi, or trypanosome. The parasite is transmitted by a vector called the triatamine bug, nicknamed vinchuca in Latin America. The bug hides between stones in the walls of houses and under straw roofs. During the night, the vinchuca comes out of hiding to feed on human blood. When it's finished feeding, it defecates next to the bite. The victim later scratches the bite, unwittingly helping the parasite to enter the body. The parasite that causes Chagas disease transforms throughout its life cycle. The parasite penetrates the tissue cells and multiplies before entering the bloodstream. Once in the bloodstream, it infects even more cells. This is the first, acute phase, which lasts about 2 months. Due to the large number of parasites in the blood during this phase, it is the only time the disease can be diagnosed. People may not even know that they are ill as symptoms are so mild. A slight fever, headache, pallor, and muscular discomfort. Chagas disease does have some very recognizable signs, but they're rare. A skin lesion around the bite, or swelling of the eyelid, called Romagn's sign. Then, nothing at all. This is the chronic, asymptomatic phase, and for years or even decades, infected people have no apparent symptoms. The disease deserves its nickname, silent killer. 10 to 30 years later, a third of sufferers develop the chronic phase. It can be rapid, and some people die without ever knowing they had the disease. During all these years, the parasites have been present in several of the body's organs. In the digestive system, they cause the colon and esophagus to dilate. In the nervous system, they can cause dementia. In the heart, it can lead to cardiac disorders, some of them fatal.
Applications in medicine. They performed a prospective randomized clinical trial to assess the efficacy and safety of posaconazole as compared with the efficacy and safety of benznidazole. In adults with chronic trypanosoma cruzi infection, They randomly assigned patients to receive posaconazole at a dose of 400 milligrams twice daily, high-dose posaconazole. Posaconazole at a dose of 100 milligrams twice daily, low-dose posaconazole, or benznidazole at a dose of 150 milligrams twice daily. All the study drugs were administered for 60 days. They assessed antiparasitic activity by testing for the presence of tcrucDNA using real-time polymerase chain reaction (RT-PCR) assays during the treatment period and 10 months after the end of treatment. Posaconazole absorption was assessed on day 14.
This is the Fox 11 10 o'clock news.
It's a disease most people don't even know they have. Then, years later, the symptoms appear, and it's all caused by an insect bite. Jane Yamamoto is here to explain why health screeners are looking for Chagas. Jane.
Well, Jeff, it is known as the kissing bug, and if untreated, it can lead to a heart attack. With its origin in Latin America 100 years ago, it's now considered one of the most common causes of heart failure worldwide. And today, a mobile clinic made its way to Van Nuys to test for the disease. One by one, people were screened, from blood tests to an echocardiogram, checked to see if they have Chagas disease.
Chagas disease is a parasitic disease.
A disease spread through the bite of this insect, common in poor rural communities in Central and South America where the insect lives, known as the kissing bug.
It bites, you go and scratch yourself, introduce the feces into your system, and that's how you get the parasite.
Many people are bitten and don't even know until it's too late. Others can get infected from a blood transfusion or an organ transplant.
In most cases, you get flu-like symptoms, last a couple of weeks, they go away, you never think of it again.
It's known as the silent disease because there are no immediate warning signs, but 10 to 20 years later, if untreated, that bite could lead to a heart attack. People living in Latin America are suffering from it, and getting medicine to treat the disease is expensive. He says treatment is costly. Thank God it is free of charge here. And as more people immigrate, Chagas is surfacing in other parts of the world. The Centers for Disease Control estimates 300,000 people in the United States are living with it.
It is worldwide one of the most common causes of heart failure. We are out here trying to diagnose the disease early to prevent the long-term complications of the disease.
And the UCLA Olive View Medical Center holds mobile screenings twice a month in Latino communities throughout the San Fernando Valley. Live in the newsroom, I'm Jane Yamamoto, Fox 11 News. Susan?
Pros and cons. Pros. Beyond the second week of treatment, tcrucDNA was undetectable in the blood of all the patients, even those who were receiving the lower posaconazole dose, thus indicated the suppressive activity of this drug. Despite the unfavorable final outcome of this treatment in their study, it is possible that ergosterol inhibitors could be useful as a partner drug in future combination therapies. Cons. Most of the patients treated with the drug tested positive for tcrucDNA on follow-up RT-PCR assays. Patients receiving posaconazole had a greater likelihood of a relevant increase in aminotransferase and alkaline phosphatase levels.
I'm Peter Block in Chicago at ACC 2016 for On the Scene. And I will bet you that not many of you folks out there are struck by terror when you think of Chagas disease. But I will tell you, in Venezuela and in Colombia, it is an ongoing problem, and there's a lot of people in the United States who are positive already. So with me is Carlos Murillo from Colombia, actually from McMaster, right? And Carlos has done a very interesting study on therapy for Chagas, which will be a very important bit of information for all of those treating this disease. So Carlos, tell me about the study to start with, and then we'll talk about outcomes.
Yeah, well, this was a study we did in Colombia, Argentina, Guatemala, and Mexico. And basically what we wanted to do is test a drug that's called Posaconazole, that is an antifungal drug that's been in the market for a long time, but just by serendipity it was seen that it has good activity against T. cruzi, which is the agent that creates Chagas disease. And we wanted to compare it alone and in combination with benznidazole, which is the standard medication that we use for therapy, but that unfortunately has a lot of side effects. So what we did is that we did a proof of concept trial in about 120 patients, 30 per group, and we randomized these patients to either the posaconazole alone, placebo, benznidazole plus posaconazole, or benznidazole plus placebo.
Okay, so who's the winner?
So actually the winner is the old guy. Benznidazole actually had a good activity against the parasite that we detected by looking at real-time PCR, so we're detecting DNA of the parasite. By 30 days, almost 95% of the patients that received benznidazole alone or in combination with posaconazole were negative, and they maintained negativity for a year. Now, in contrast, posaconazole had good activity in the first 30 to 60 days, which is when treatment is given only for 60 days. But once treatment was stopped, almost 80% of the patients became positive again, which means that probably posaconazole has a trypanostatic effect and not trypanocidal.
Okay, so let me ask you a cardiology question because, this disease causes right ventricular aneurysms and heart failure. When can you still make patients better?
That's a great question, and at the ESC we presented the BENEFIT trial, which actually was the largest trial in Chagas disease, randomized almost 3,000 patients in 5 countries that already had some early cardiomyopathy to benznidazole or placebo. And unfortunately we didn't see any effect. So probably it's earlier stage like the stop Chagas, which are patients that have the infection but still don't have any cardiomyopathy. These patients had a negative ECG and a normal echocardiogram. So probably early intervention is where we're able to probably delay the progression of cardiomyopathy.
All right, so you've had it from the mouth of the expert on Chagas disease and a quick review of the whole disease, including cardiomyopathy secondary to it. Treat early sounds like the right answer to this, and now we have a good treatment for it. Thank you very much, Carlos.
Thank you.
Issue applied in Ecuador. Chagas disease is transmitted by the triatoma insect in rural and suburban areas of Mexico, Central America, South America, and the southern United States. High risk is present in the following coastal provinces, including urban areas: Guayaquil, El Oro, Los Rios, and Manabí. Risk also exists in rural areas of the provinces of Loja, Azuay, Bolívar, and Cotopaxi. Blood supply screening is mandatory. Public health education and eradication programs have started. Conclusion. In conclusion, in patients with chronic Chagas disease, treatment with low-dose or high-dose posaconazole resulted in a significantly larger percentage of treatment failures than did treatment with benznidazole, which is the current standard of care.